I have another exciting smile makeover case to show you this morning. And this one is very unique because of her age. So let's discover her smile and maybe yours someday. On the top is this what this young lady looked like when I first saw her. She had been in orthodontics for some time to straighten her teeth, and this was the result. And she was born without her upper right lateral incisor. We call that congenitally missing lateral incisor. And on her braces, they put a little tooth, so she looked like she had braces in all of her teeth. But of course, that's not a permanent fixture. What also is exciting for her is that she is to be a senior in high school and was ready to take her senior pictures within a few weeks. And she did not want her senior pictures to have braces on with that missing tooth. And obviously, she did not want senior pictures to look like this. So, first, we look to see what can we do for her. And there's two options for the missing tooth. The most common option is today, anyway, not years ago, but today, is to put an implant in that space. The problem is, in her case, that the roots of the teeth next to the space were so close together, there was no room for even a skinny implant. So we didn't have a choice but to do a permanent bridge, which we've been doing permanent bridges probably for 100 years. There's nothing wrong with a permanent bridge. It's just that today's thinking is that an implant is the treatment of choice. So on the bottom are the final results. We have a permanent bridge in the space where the tooth was missing, and we crowned and veneered the rest of her teeth to do her smile makeover. And here's a close-up view of the before and after. She did try to bleach her teeth beforehand. It is unusual for me to put veneers and crowns on an 18-year-old, or probably 17 actually, in her case. The nerves are very large in the teeth, and you have to be very careful not to irritate the nerves in her teeth. So we usually wait to a later stage. But the bleaching obviously didn't help. She had some splotches on teeth and indentations that picked up stain. Her teeth were yellow and they weren't bleaching. So to have a nice pretty senior picture, there wasn't much choice but to accomplish what we did in the bottom picture. Here's to the left is her right hand view looking at that space. It looks like plenty of enough room for an implant in this view, but when you take the x-ray, the neighboring roots aim toward each other and there's no room for the implant up high. So on the bottom, on the left, which is her right hand side, you can see the permanent bridge. And we veneered her lower teeth too to get everything nice and pretty. And then on the right hand side of the picture is the view of her mouth from her left side. And in fact, on the bottom, you can see the little splotching, the indentations of a lateral incisor, and then we put the veneer on it, and they look gorgeous. Veneers today are so healthy too. We used to have to go below the gum line with our old crowns that had dark metal underneath them, and then as the years went by, the gum line got dark, and not anymore with our all porcelain veneers. Technically, I don't even put the margins, that's where the crown ends at the gum line, below the gum line. So the gum is not irritated for years to come, and they look gorgeous. So here's our young model before and after. She is tickled pink, and she got to have her senior pictures done just shortly after we finished. She was excited. Those senior pictures are going to be with you forever. So, if you too would like to discover your smile, have a smile makeover, give us a call in Jacksonville at area code 904-731-2162. If you would like to see what we do for people, we have many photos on our website of before and after cases. And the website is at www.kanehldental.com. And if you'd like to have a free consultation, call us, say you listen to this video, and we'll be glad to see you at no charge to hear your story and come up with a plan to discover your smile. Have a great day.